Hi, folks. Class is in session. My name is Jim Noble. I'm a certified financial planner, registered investment advisor, and wealth manager here in New Jersey, helping people prepare for retirement. Today, we're going to talk about your health care. Your health comes first, and the 5-step process to creating a successful retirement plan. So, let's talk about your health care as it relates to retirement. So, the first question is, how old are you going to be when you retire? Are you under 65 or over 65? Now, it's hard enough for people to retire early these days, given the financial burden of covering our costs in retirement. How do we do it with healthcare? Right? So, healthcare is the most important risk for you to protect against in retirement, through your whole lifetime. Medical, uninsured medical costs are the number one cause of bankruptcy in America every year, year after year after year. So don't put yourself in a bind where you're going to be faced with uninsured medical costs. So, how are we going to do that? Well, if you're retiring prior to age 65, you're entitled to COBRA is the extension of your healthcare benefits that your employer is providing. The difference is you pay 100% of the cost instead of it being subsidized by your employer. This is essential to have this insurance to protect your assets. Now, COBRA is one option. A second option would be to sign up for a individual health plan under the Affordable Care Act, and you can do that at healthcare.gov. Another option is to have coverage through your spouse's plan. So when you lose your job or leave your job, you have what's called a qualified life event that allows you to make changes to the options that you selected on your health plan through your spouse's employer. And of course, if we're eligible on income and we're eligible for Medicaid, it's likely that we're not going to be retiring early. Now, 2022 enrollment runs from November 1 to January 15. And of course, that's passed already. Each year we have that open enrollment period. However, if you're leaving a job, you don't have to worry about the enrollment period. You have a special life event that allows you to enroll in the Affordable Care Act plans. What you pay for that insurance depends on your income, and you can apply for coverage several different ways. And you want to go to healthcare.gov, not healthcare.com. Healthcare.gov is the government's resource for this. Depending on the state you live in, your state may also have their own plan for the Affordable Care Act. Now, if you're over 65, then you're eligible for Medicare. You can sign up within the first 3 months before you turn 65. Now, if you're still working, a lot of people have questions about this. However, if you're disabled, you may have access to Medicare prior to age 65. So, what is Medicare? How does it work? Medicare is divided up into different parts: Part A, Part B, and Part D. So we skipped Part C, but we'll talk about that as well. Now, hospital expenses under Part A are covered after you pay a $1,484 deductible each time for each hospitalization. So after that, there's some co-payments, but only after the first 60 days. If someone's in the hospital for more than 60 days, that's a catastrophic event. There's very few people that are in the hospital that long. Part B is outpatient procedures, doctors, and outpatient testing and other sorts of procedures.
There's a $233 deductible after,
For which Medicare covers 80% of the amount that they approve, and you cover the rest, either through private insurance or through your own wallet. Now, Part B does not come free. Part A comes free if you've paid in to the system for 40 quarters, not consecutive necessarily, but 10 years worth of employment gets all of us onto Medicare Part A. But Medicare Part B carries an annual premium, a monthly premium that for most people comes right out of their Social Security check. And so it's not an option. You must enroll in Medicare Part B at the time of your enrollment eligibility, which for most people is 65, unless they're still working In that case, they get to defer their enrollment in Part B until they leave their employer. And so it's important that someone 65, even if they're working, enrolls in Part A, Part B after they leave. And then the cost for Part B is dependent on the income. You see this chart here, it's a sliding scale. As income increases, so does the monthly payment for the Medicare Part B, which is a per person charge. What's not covered by Medicare? Well, things like eyeglasses, eye exams, dental care, and non medical services. So, if we talk about long term health care, assisted living, home care, nursing homes, none of that is covered by Medicare because it does not qualify as medical care, it's non medical services. So, how does a Medicare claim work? What we're going to do here is go really quickly through an example of someone who has Medicare and needs services. So, for this situation, we're going to use Mary, who broke her hip and required surgery. So, she had a hip replacement surgery, and if she only had traditional Medicare, nothing else, she'd be okay, but she'd have to cover some costs. The hospital deductible of $1,484. And then when she goes to rehab for her hip replacement rehab, the first 20 days are covered and days 21 and beyond carry a copayment. After 100 days, there is no coverage. Now, Medicare Part B kicks in when you go to the doctor, and
There's a $233 deductible.
for those each year for Medicare Part B. And after that first $203, Medicare covers 80% of the amount that they've approved for that charge, which is not necessarily the amount you're being billed, because the provider is allowed to charge more than Medicare's assignment amount. But for most providers, assignment is accepted. So so there's generally not a lot of additional out of pocket costs on these charges, but it is different depending on whether you have traditional Medicare or a supplement. Now, here on our case study, Mary now has a supplement coverage, Plan G, with a monthly premium. Plan G is one of the approved plans that is offered by private insurers to supplement your Medicare. They're called Medicare supplements. So the supplement covers, in this case, covers the hospital deductible. It covers the co-payments all the way up to day 100 for her rehab in the skilled nursing facility. Plan G does not cover the deductible, but it covers everything after that, including all of the excess charges that the providers may bill in addition to the 20% that Medicare isn't paying. And again, home health care, only medically necessary services related to a prior hospitalization are covered. Now, in our case study, if Mary had a Medicare Advantage plan, that works kind of like a Medicare HMO. And in this case, Mary would have selected an in-network hospital, and the Medicare Advantage plan would essentially cover all of that rehab and the costs associated with the hospital stay. There may be a copayment that she pays depending on which Medicare Advantage plan she has, because they're all different. Each company comes up with their own unique features and benefits. They receive a monthly payment for each participant, and then they provide a menu of services that may differ from what traditional Medicare covers. Many plans have co-payments for covered services, PPO networks, and restrictions on access to care outside of your coverage area. Now, Medicare Part A, the Part B premium, that's a typo there. The Medicare Part B premium has a sliding scale. Medicare supplement plan can cost $144 to $400 a month, depending on the age and the sex. And a Part D plan, we haven't mentioned that yet. Medicare Part D is prescription drugs. You must enroll in a prescription drug program when you're eligible. Otherwise, you pay a penalty for waiting. So these are key elements to know. Now, what if she can't go home? What if Mary's not going to recover? Long-term care is not covered by Medicare. If Mary can't go home due to a chronic condition, such as Alzheimer's or dementia, then Medicare does not cover those services. Medicare covers short term restorative care for hospitals and doctors, and Medicare does not cover custodial services like personal care, cooking, housekeeping, shopping, all the things that we need if we're going to remain at home. Now, which covered options are right for you? Well, you can visit Medicare.gov and learn more about this. Again, Medicare.gov, not a .com, but a .gov website, and you'll get to the government provided information on Medicare, including the ability to shop virtually every Medicare supplement plan that could be offered to you on their website. So all that information is available to you. If you click on it to get more information, you're likely to be directed to a sales agent who's going to try to sell you one of these plans. Now, if you want to get objective advice, I suggest that you speak to a professional and then go through the search process for your product. The people that sell the insurance aren't necessarily the ones that are best suited to help you evaluate what's in your best interest. That's the job of a registered investment advisor, a certified financial planner, someone who can give you guidance with respect to your best choices. So that option is available to you by calling my office or reaching out with an email. There's my email address. I look forward to hearing from you, and I look forward to seeing you on our next installment of the 5-step retirement checklist. Thanks. My name is Jim Noble. I'm a certified financial planner, and I'm here to help you with your retirement. Thanks.